How do you see the fundraising in healthcare? Obviously, it's complicated. My career has been in healthcare, and there's many challenges, but it's basically addressing the issue of behavior change and integration with the um, healthcare engagement with the physician and with nurses, and being able to integrate all of those and
Oh,
bring that together under one roof, because obviously physicians can't spend enough time with patients. And if you get into rural locations, there aren't enough physicians. So using AI in that vein, do you see uh, any players out there that are of interest? Obviously there's some huge players in healthcare. So I didn't know if you've touched upon any of them, or you're hearing any groundswell in that area.
Great questions. Thank you. Ken.
yeah, great question. And for part of the time, I was thinking you were going somewhere else, and where you went is actually much more interesting. First of all, I don't have a great deal of expertise or familiarity with AI application into the issue of doctor and end patient relationship. That AI could be used to drive a more efficient communication with a patient strikes me as inevitable. I'm not aware of any particular players at scale involved in that, but I'm also not aware of any players at scale engaged in that business, period. Meaning, when you talk about a rural hospital or the ability of a family practice or internist to deliver health services that way, I think that I would start with the basic premise I shared about my own industry, that there is a almost immutable personal component to the relationship that AI can't replicate or replace, but then there is significant room for efficiencies and utility. And I could see some revenue model forming out of AI being able to help replace some of the antiquated systems that we all make fun of regarding every trip to the doctor involving us filling out a paper and clipboard, survey again. So record keeping, medical history, sharing of information, there's a lot of utility there. I don't imagine it's massive revenues, but it's certainly going to be great efficiency.